information pages if you're interested. So.
We also know how to get in touch with her too. And here's our website, uvef.us. It has our contact information. We can help put you in touch with her if you would like more information. Our next speaker is, thank you very much. Thank you, Stacy. I'm not very experienced doing this, as it should be very clear to everyone. Our next speaker is Dr. Michelle Hofmann. She's Medical Director of the Primary Children's Medical Center Pediatric Unit at Riverton Hospital. She's an Assistant Professor of Pediatrics at the University of Utah and teaches a medical student elective course on human health and the environment. Dr. Hofmann is the current president of Breathe Utah and has participated in numerous multi-stakeholder collaborations, including the Utah Clean School Bus Project, Idle Free Utah, Salt Lake Solutions, Air Partners, the Clean the Air Challenge, the Utah Asthma Task Force, the Mountain View Corridors Air Quality Working Group. She is an active member of the Utah chapter of the American Academy of Pediatrics and the Utah Medical Association, advancing environmental health initiatives with both organizations. She was recognized by the Utah Medical Association in 2009 with their annual environmental award. Michelle is on the board of the directors of the Utah Clean Cities Coalition and served as co-president of the Utah Moms for Clean Air from 2009 to 2010. She has written public comments advocating for stronger national ambient air quality standards and has spoken to numerous audiences along the Wasatch Front regarding the health implications of air pollution. Do we have any time left? Please, Michelle, take over.
Thank you. Stacy graciously asked me to give a little bit of closure to her talk on talking about some of the solutions to our air pollution problem. We've heard a lot about the science. We've heard a lot about individual behaviors and things we can all do. And really, I feel like there should be a focus on multi-stakeholder collaboration. Right now we've got, I just learned this new analogy, the silo analogy. We've got our federal agency, the EPA, we've got our state agencies, the Department of Health, the Department of Environmental Quality, we've got our community and our citizens, and we're all in our own little silos trying to work on this problem, and we now need to break down those silos and get together and start working on this together. So first, we just launched a new group called Breathe Utah, and I wanted to talk a little bit about our mission, which is to advance real solutions to Utah's air quality problem. We want to acknowledge all of the wonderful science that Dr. Pope and everybody else has presented today, and it has to move beyond the need for individual responsibility. We are out there working with the communities. We need effective public policy to help make the big changes. The low-hanging fruit has been picked, as Stacy said. And so we'd really like to move our emphasis away from some of the projects I'm going to describe today to really impacting policy. I'm going to describe a few projects today, including some efforts that are being done right now between the Utah Asthma Task Force, which is a joint collaboration between the Department of Health, and there also is Department of Air Quality representation there, and it's been a nice venue to get some projects forward in the community. Salt Lake Solutions, which is a venture sponsored by Mayor Becker's office, the Utah Clean School Bus Project, Idle Free Utah, and then the Air Quality Working Group for the Mountain View Corridor. So the Utah Clean School Bus Project. Diesel school bus retrofits are aftermarket additions that you can add on to existing diesel engines that reduce tailpipe emissions, and they're efficient, easy to install, cost effective, and really have significant pollutant reductions. We've heard from several people the contribution of our mobile sources and diesel emissions are particularly worrisome for their contribution. This project has a long evolution, but from the advocate side, it started with an early meeting after Utah Moms for Clean Air first formed, when we sat in their office and they tried to educate us about air quality, and we said, well, what can we do as moms? And Cheryl Hines said, work on diesel school bus retrofits. Subsequent to that, the EPA actually approached our group and said, okay, how come Utah isn't getting any funding for diesel school bus retrofits? It didn't make any sense to them in the Region 8 office that Utah wasn't using money that was available federally to improve our school bus fleet. So that year, we worked with Representative Christine Johnson to pass House Bill 146 school bus amendments, which was twofold, a twofold legislation. One, it provided for mandated school bus driver education on idling of school buses. So every school bus driver in the state of Utah is now educated to not idle their buses. The second piece was funding that provided seed money that showed to the federal government that the state of Utah was interested in doing these diesel school bus retrofits in their schools. And so that $100,000 that they granted in that appropriation then brought in tons of federal funding through a lot of grants in a collaborative process that brought together all of these stakeholders in our community: the EPA, our legislature, the DEQ, UDOT, all of the metropolitan planning organizations, including Mountain Land Association of Government, who's here today, the county, and advocacy groups. And we've had over $2 million to date to retrofit school buses throughout our entire state. You're welcome.
Can I add in that Michelle really is the one that made that happen. She's the one that really got that through the legislature.
Okay. Next project, Idle for Utah. So vehicle exhaust really, we know, is one of our leading sources of air pollution, particularly in our valleys. And unlike driving, idling is unnecessary. And there are a lot of myths out there about idling. And we know now that idling 10 seconds uses this. There's a myth out there that idling, you burn more gas restarting your engine than leaving it at idle. Well, that's actually not true. You can idle for 10 seconds or less, and you're not burning more gas each time you restart your engine. It also does not increase your starter maintenance if you're turning it off and on about 10 times a day. And so you're not increasing the cost of maintenance of your vehicle by turning it off if you're going to be at a prolonged idle. There's also a myth about what you need to do to warm up your car in the wintertime. Well, people think they need to turn on their engine and leave it sitting in their driveway for a few minutes to warm up in the winter. Actually, you warm up your car by driving it, not by leaving it at idle. And so that myth needed to be dispelled. Charisse was very instrumental in going out to schools in the elementary school community very early in Utah Moms for Clean Air and starting to talk to them about idling. And really, it does make a difference to empower the youth. They need to make this a habit. It can't be a behavior change. We deal with behavior change in medicine all the time, and people don't change their behaviors. It has to be a habit from the ground up for kids. We enrolled local leaders. We had a lot of attention from Salt Lake City and Salt Lake County, and the message was being brought up by a lot of different people and not very consistent, and that's where the local government was very instrumental in providing the resources and the ability to convene stakeholders to make a more consistent message. And so that's what we did. 2 years ago, we launched the Idle for Utah campaign. The message is simple: turn your Kiwi idle free. You save money, you breathe easier, and you protect the environment. Very simple for people to understand. As Stacy said, it's very difficult to reach the masses. We need to stop preaching to the choir and get to everybody. And so below you see all the partners in that effort. And there's a week-long campaign now each fall around the time of school opening where we are out in schools. We were out in schools throughout Salt Lake County the last 2 years distributing this information to parents picking up their kids. And this year, Governor Herbert proclaimed that same week, Idle Free Awareness Week, and the plan is to go statewide with these efforts. And then just as a side note, we tried to measure our results from some of these actions. I think it's hard to identify what are the solutions that were actually effective and doing something. As a result of House Bill 146, they measured the idling reduction time of the school bus drivers, and they saved 92,000 gallons of fuel and 5,000 pounds of particulate matter. Mayor Becker has a wonderful program called Salt Lake Solutions, and the intent of that program is to engage the community and include input from the people who are affected by the decisions that policymakers and government officials make. And their third project involved air quality. and I feel very privileged to have been a part of that process. And what the Salt Lake Solutions Air Partners team did was convene multiple opinion leaders in the community and throughout the state to prioritize a community-based project for air quality improvement. And their first project happened last summer, and it was called the Clear the Air Challenge. We identified that reducing vehicle miles traveled is a necessity in our state, and as a result of this 6-week challenge to the community to try and reduce the amount of vehicle miles traveled, we saved over 120,000 trips, over $650,000, and over almost 2 million pounds of emissions. Salt Lake Solutions is continuing on in their activities, and they're using the individual partners to carry on their messaging about Drive Less themes. They're piloting a curriculum in schools around Drive Less themes. They're also convening folks interested in identifying strategies to encourage people to drive less on red alert days. And that's something that we've been trying to mobilize around for a while and not really been able to launch off the ground successfully. And I think that through this multi-stakeholder process that Salt Lake Solutions has, that we may be more effective in doing some kind of program that really targets the red alert days. They're also the recent recipients of a lot of EPA funding to take these efforts statewide, and that's really exciting. The Mountain View Corridor was an interesting project to work on. Obviously, we've got to get at the root cause of a lot of this, and the urban sprawl that results from a complete reliance on highways that we have in our car culture here in Utah is a big problem. Federal transportation policy really focuses on continued building of roads. 80% of funding goes towards building new roads rather than towards development of mass transit. So our group recognized that the highway that was being proposed early on was going through the backyards of many schools, and that was really concerning to us. We know that the near roadway sources of air pollution are really posing a disproportionate impact on people who live and go to school near highways, and that was concerning. And the community wasn't really aware that this major highway was going in their backyard and through their schools. And so it started locally with a bunch of different advocacy groups going door to door. Became much more official when Utah Physicians for a Healthy Environment and Utah Moms for Clean Air collaborated on public comments through the draft environmental impact statement process, as well as public comments in support of expanded tracks. We were privileged to meet with the leadership in the House and the Senate on issues pertaining to this highway, and we participated in year-long multi-stakeholder discussion around this highway. And we changed the feel of the highway. As it was going in its initial phase, it had 4 lanes in each direction. The initial phase will now have 2. It is going to be built in stages. Each stage will have public transit that goes in along with it and needs to be completed before the next stage of highway goes in. The initial highway had no public transit included in the plan. And then the piece that I'm continuing to work on, as a result of this stakeholder discussion, $3.1 million for air filtration systems for the schools along the highway and $1 million for air monitoring for these schools during each phase of the development of the highway has been set aside and provided by the Utah Department of Transportation to be used by and to be disseminated at the direction of the Air Quality Working Group. And we are proud to have 3 of the 8 members of that Air Quality Working Group as members of Breathe Utah. Then the last piece that I really want to address is that we've got our Department of Environmental Quality and our Department of Health, and there's very little opportunity for intersection. We're out here trying to talk about the health impacts of air pollution, but these 2 agencies don't really intersect all that much. And that lack of intersection is really an impediment to progress. The one venue that I have found where you can make do some work in this area is through the Utah Asthma Program. And 2 projects specifically that I wanted to highlight were the PM 2.5 school recess guidelines. So what do? We've got kids who are going outside to play when the PM 2.5 concentrations are 90 or above for 15 minutes. What does that mean? There's no science out there to tell us what that means to have a 15-minute exposure to a 90 microgram per meter cube density of PM 2.5. We don't know what that means. We also have an obese population, and we want kids to be outside exercising. And we're really tired of the Band-Aids that say keep your children or yourself inside to protect yourself from these PM 2.5 concentrations. It's not an acceptable solution. So we worked together for over a year to identify what sort of guidance we could give to schools to decide if and when they should cancel recess, and that information's available on the Department of Health website. It's still not strict enough, when we're keeping kids in. I can tell you that as a pediatrician and mother, and as a participant in the collaborative process, to not get the standard that I wanted, it's frustrating. We don't have the science to back us up to tell us what the safe level is to expose kids to each day at recess. The last one is the Ozone Guidelines. This was an interesting process. I was wondering how come our Department of Health didn't really know much about ozone, and I asked them to look into it. I'm like, we've got this ozone problem. It's a very predictable pattern. We can be doing things to protect public health while still advocating for exercise outdoors during the summertime. And so the Department of Health actually created a white paper on ozone, and they found no safe level of exposure to ozone, which isn't surprising to some of the scientists working on this problem. But you've got that on one side, and then you've got the DAQ has a specific standard that they need to enforce. So it's really hard to bring those two groups together and come to some kind of consensus on what the public health messaging should be. I worked with the Utah Medical Association to have a resolution passed that promoted the collaborative process to define some protective health guidelines. And then I met monthly with Department of Health and DAQ. For 6 months, we reviewed the ozone literature, and we tried to come to some kind of consensus on recommendations that we could make. And those were released last summer in time for ozone season, which is a neat thing. The air idea is only the only air worth breathing.